I'd like to introduce our next presenters from UBCO. We have the UBC Cultural Safety Modules, Eric Mitchell, Chris Marchand, and Jesse Nyberg. Holy, how do you follow all of that? So, going to talk about a project that Chris and I have been involved with since 2008. But prior to that, there was some work done at UBCO here. And so after we had done it for a bit, Chris reminded me that before the door opened for us to come into the institute here to do this work here, through Lyle Mueller, I spent about at least 6 years or 5 years coming to the annual Aboriginal Career Day and setting out a teepee in the middle here somewhere. And little did I know that one day I would actually go inside. And so of all the people that created this door opening and project that followed, the four of us here have been through thick and thin and carrying on. But we'll share with you in a little more depth in a bit here as to all the people that work together to get that door open. And so I'll always think of Donna Kurtz as the one that represents the university here in opening that door and keeping it open for us to do this work. So Donna Kurtz from UBCO School of Nursing, Jesse Nyberg, who is, I always say, I blame her for getting me involved in this because she asked me to come and join this committee. Elder Jesse Nyberg, who is a UBC adjunct professor, and myself, my wife, Chris Marchand, and myself are, we have a title too, UBC adjunct professors in facilitating these Sukanakinik health modules. So I'll ask Donna to come first because she can more clearly describe the work that was done to have the door opened in the first place.
Good morning. So about the background for the Aboriginal health modules, Joan Buttorff was actually the one that got the first funding through Health Canada, but it's based on the background of history and other projects and the Barriers project that Mike talked about, and findings that came from there. And the Canadian Nursing Association has a call for action to have more Indigenous nurses and for nurses to understand the history of our Aboriginal people. So they said no group in Canada suffers greater discrimination or ill health than Aboriginal people. And then the Tripartite First Nations Health Plan 2007 said urgent actions are needed to close the gap between Aboriginal and non-Aboriginal people in BC and in Canada. First Nations Health Human Resource said Aboriginal people should determine whether the health service that they get are delivered in a culturally safe way. And there needs to be multi-level, multi-sectoral collaboration and commitment needed to address the gaps and include full involvement of Aboriginal people in their health care. So the funding was from Health Canada in 2008 to increase the number of Aboriginal people working in health careers, because research tells us if you have brown skin and you work with people that have brown skin, then the results are better, and that relationship, Jeanette talked about relationships, how important they are. Adapt healthcare educational curricula to support the development of cultural competencies and improve the retention of healthcare workers in Aboriginal communities. So since that time, 2008, UBC Okanagan has been kind enough to continue to fund the education of our health science students.
Well, we're going to do the best we can. You know, when we were planning this part of the thing, we at first had 5 minutes and 7 minutes. Now we got 15 minutes. So, and we're trying to talk about something we did for 4 years and about a history that's 12,000 years old. So just bear with us. So this timeline, let me see if I can. Good thing I got my new glasses. I can kind of read it. In 2008, Faculty of Health and Social Development had these darn acronyms. Aboriginal Human Health Resource Initiative funding. That's the funding that started it all. And Donna did mention the person that actually wrote the first proposal. And actually, we never did meet that person. You know, I'd like someday to meet her and thank her for that. So the advisory council that is talked about here, there was 20 members, some from local First Nations, some folks from the Métis group, urban Aboriginal elders, and community members, interior health care providers, and interior health care providers in the Okanagan Valley. And so people from UBCO Nursing, from Human Kinetics, from Social Work, from Health Studies Education, from Indigenous Studies, from Aboriginal Programs and Services. Those are all, out of all those people there was 20 that came together quite a number of times to, you know, move this project forward. And that's about the time that I was asked to be involved. That's why I blame Jesse for asking me to come sit on this committee to help develop curriculum for these modules. At that time, of course, I don't think we knew they were modules. We were just going to put some curriculum together. And because of some work that Jesse and I had done in the previous year around language books, I guess she liked the way that I expressed myself and some of the things that I said, so that's why she invited me along to sit with them. And then I dragged Chris along to a few meetings, and then so she got involved too, so we've been with them ever since. And over a period of 18 months, we had quite an intense group of people. I think there's a few that aren't mentioned here. Carlene Dingwall was very instrumental in helping things be put together. She was actually the coordinator at the time. Peter Hutchinson did I say his name right? It was another one that sat through us through thick and thin for that 18 months and provided input. Shuswap Band Council member Jean Brown was amongst the first group to talk. Judy Mays, she was the IH rep at that time. And Diana Moore, who is current Aboriginal patient navigator now. And so they all helped us in talking about the kinds of curriculum. Holy, 5 minutes already. So the idea of us showing you this is, in a very short time, is that we are going to have a table set up in the Aboriginal room there where we could talk in more depth and have people come there and ask questions and all those, anything more that you'd like to know about our project. But some of the key elements that guided our work is we let them know really clear off the beginning, and they agreed with us that in telling our story as Aboriginal people or Okanagan or Syilx, only we can tell it the best. And listening to Jeanette at the beginning there, and all the depth of knowledge that she talked about in what's seemingly a simple story is a good example of that. People can read statistics, they can read even that story and not get any of that knowledge at all because it's all underneath. And only we can tell our story the best. And so that's what's guided our journey so far. And so this last little bit, I'd like to ask Jesse to talk about.
This just quickly tells you that there was a curriculum evaluation, and also part of it was research. And 540 students completed a survey at the end of each module. 13 students who took the course completed pre- and post-surveys. We had 4 talking circles facilitated by Elder. There were 24 participants, and we had 3 with students and 1 course with instructors and knowledge keepers.
Yeah, from the findings of doing the modules, a lot of the students had very little knowledge about Aboriginal people. After taking the modules, it really increased from 8% to 48% my role as a health professional, and that's how much they've learned, and right down to as a result of the modules, my knowledge and understanding about the Aboriginal people in Canada has increased significantly by 58%, and about the Okanagan Nation, it increased by 69%, starting out from 2%. So we managed to share a lot of information in a little bit of time about our people. And I guess we do it in a way that makes everybody feel comfortable and safe. And so they're, of course, as always, when people first get together, it's, we're all strangers and stuff. But one of the ideas of bringing us together and developing the curriculum, the part that came to me during that time was this was going to be the first time that we were going to be together as us as Okanagans and Aboriginal people to sit down and talk with non-Aboriginal people. So it had to be a very safe place, and that's how we do the classes, is in a circle and share a lot of information about us as Okanagan people and where we want to go. So thank you.
And just before we close, I just want to show you a few of the comments that were made by the students. As this course should be mandatory for all helping professionals. I'm better able to see how narrow and how non-holistic the medical model is. And I much more appreciate my role on this earth as a participant rather than a bystander or a spectator. So it was just totally amazing, and I believe extremely significant. And we're still carrying on. The modules are part, at this time, of mandatory curriculum for the nursing students. But our goal ultimately would be to see it across the campus. And we do have curriculum developed for a standalone course that has been offered once, but it's difficult again for funding to make something sustainable and ongoing. So thank you.